Hi, and welcome to Building a Winning Koop and Innovation Award Application webinar that's hosted by the Health Project. I'm Dr. David Ballard. I am chair of the Health Project. I'm just going to introduce and kick off the session, and you're going to hear from Dr. Ron Goetzel, who's going to provide an overview today. Ron is the president and CEO of the Health Project. He's a senior scientist at Johns Hopkins Bloomberg School of Public Health. You'll hear from him for an overview, and then you're going to hear from Gavin, who is a member of the board of the Health Project and a former winner of the Everett Koop National Health Award. He's Wellbeing Officer at Baylor College of Medicine. So we'll hear from him, and then we'll have time to field questions that you all may have about applying for the Koop Award or applying for the new Innovation Award, which you'll learn more about from Ron in just a minute. Just a housekeeping item really quickly. For the question and answer portion of the session, at any point during the webinar, you can click the Q&A box at the bottom of the screen. So if you don't see it, it may be under a More menu item, but it may show up as a Q&A box at the bottom of your Zoom window. You can click on that Q&A, type in your questions. You can put those in at any point during the webinar, and when we get to that Q&A, we'll field those questions and answer those for you live here on the webinar. With that, I'm going to hand it over to Ron Goetzel. Ron?
Well, thank you so much, David, and welcome everybody to this webinar. I'm really delighted to have so many people interested in the Koop Award, and I'll walk you through it. And as David said, we'll have Jesse talk about his process of applying for the award and winning the award, and then we'll open it up for discussion and questions. So, of course, the award is named after Dr. C. Everett Koop, a former U.S. general. He, interestingly enough, at age 65, was offered the job of U.S. Surgeon General. This was under the Ronald Reagan administration, and even though he was very conservative in his beliefs, religious beliefs and political beliefs, he actually made formidable progress in many important areas like smoking cessation, AIDS prevention, and women's health. So he became known as the nation's doctor, and even today, so many years afterwards, he's still recognized as one of the most important Surgeon Generals this country has ever had. So Dr. Koop and some other people back in 1994 began the Health Project, and the mission has basically stayed the same. It's morphed a bit, but it is to define, promote, and increase adoption of organizational health and well-being practices that translate into measurable operational impact. So the important part is it's organizations that we're looking at. We're looking at organizations, employers, people where we go to work every day, and how the organization can promote health and well-being of its workforce. Our vision is to promote evidence-based health and well-being practices, demonstrate high-performing healthy workforces that drive organizations, communities, and the nations to thrive. And our purpose is just plain and simple: identify advanced strategies that amplify the value of workforce and community health and well-being. And here's the application overview. So we've been in business now for about 30 years, and about 75 organizations have won the award. Many more have received honorable mention. But to win the Koop Award, the program must employ comprehensive evidence-based strategies designed to improve the health and well-being of the entire population, that entire workforce, have been in place for a minimum of 3 years, be well integrated into the organization's infrastructure, and yield significant improvements in population health and noteworthy business results. And that's what distinguishes us. It's not just you have to prove people improve their health. Also, there was a business impact from this program. So very simply, the application must answer these three questions. What was done? Did it work? And was it worth it? Judging is weighed heavily. 60% of the points are focused on documenting health and business outcomes. Here's some of the past Koop winners, and included on the list is Baylor College of Medicine. You'll hear from Jesse in a moment about his experience going through the application process. But many of these are name brand organizations, but some are actually quite small and provided data to show at their level that their organization improved the health and well-being of their workforce. So how to prepare a strong application? we've got these webinars, and there are many other webinars included. If you go to our website, which is thehealthproject.com, you'll see some webinars of past winners. You'll also see the applications of award winners from 1994 forward. So those are out there available for anyone to look at, not just the program itself, but also the data that supports the program. The application is due at the end of May 30, 2025. Now, for those organizations interested in submitting earlier, by May 17, you can submit your application and ask for a quality control check. And we will review those applications in the 2 weeks prior to the deadline to see if basically it adheres to the requirements of the application. Things like the report ends, or the graphs and tables and charts, do they make sense? We'll provide that kind of level of feedback, but not obviously a full review. So here are the different sections of the Koop application. These are the areas that are asked about: leadership commitment, culture, planning, communication, intervention components, integration, benefit plan design, coordination, program coordination, data management and evaluation, a comprehensive approach, and integration. So this is basically the intervention itself, the guts of the program. You need to describe the various elements, and there's a word limit to each section. In terms of methodology and results, we want to find out about population health management strategies employed and the top health issues that were addressed and how they were determined. Credible program evaluation methodology and results, connecting the program elements and measurable outcomes. And then documentation of improved health and risk reduction, and of course the business value. And these can be described in many different ways. Whatever is important to the business itself. Could be medical savings, reduced absenteeism, increasing work productivity, improved attraction, retention of talent, job satisfaction. Whatever metric is important to that business, documenting that metric has been affected in a positive way by the program. And of course, we want specifics. We want numbers, ends of eligibles, participations. If you've got subpopulations or cohorts, their ends, clearly labeled charts and graphs. So this is the first year we're introducing the Health Project Innovation Award. So what do we mean by innovation? What are some examples of innovations that organizations have put in place? For example, engaging hard-to-reach populations, organizational culture change initiatives, addressing difficult challenges such as pandemics, new approaches and models to change, health-related behaviors, health equity, effective use of technology, and focusing on broader environmental, social, and economic factors important to the organization are examples of innovations. To be eligible for the Innovation Award, you must have the program must have been implemented for a minimum of 1 year. So that's different than a Koop Award, where it's got to be in place for 3+ years. But it needs to be well integrated into the organization's broader health and well-being initiative. It needs to incorporate evidence-based elements of sufficient intensity to yield population-based response, what we call a therapeutic dose, and be supported by initial evidence of improvements in population health and, again, noteworthy business results. Here are the criteria for the Innovation Award. It must answer these questions. What was the innovation? How did it show significant impact for the population up until now, even though it's young? And how will it improve the overall health and well-being of the workforce? So these are the criteria for our evaluation. Program has to be evidence-based, novel, sustainable, scalable. You've got to demonstrate participation and engagement of the target population, health and well-being outcomes, and again, business outcomes. So preparing a strong application, again, this is the first year for this award, so we're going to see what kinds of applications we receive. The due date for this award is a little bit later than the Koop Award. It's June 31, 2025. And again, if you want to submit the award ahead of time, 2 weeks in advance, you can send it through, and then we can do a quality control check on the award to make sure the basic elements are there. All right, here's some resources that are available to applicants. Certainly, our most important resource is our website, thehealthproject.com. And here you'll see the application for the current awards, the 2024 winners, and support for the Koop Award. And there are lots of videos and different tools that are available there. So once again, the Koop Award due May 30, Innovation Award due June 30. And the way that we review these applications, each application is independently reviewed and scored by 10 to 15 expert reviewers comprising industry experts. We have board members, we have advisory committee members, and we also have external reviewers who are part of that panel. The final determination of winners is made at a board meeting that follows the independent review of these applications, and positive reviewer feedback is made public and can be found on the website so that the ideas and lessons that have been generated from these applications can be shared with everybody else. And of course, we recognize winners each year annually. We've done it at the Hero Forum for many years, and we'll do it again at the Hero Forum this coming fall. Here are some examples. DTE Energy is a winner, and Idaho National Laboratory as a winner. So the question might be, which award should I apply for, or for which award should I apply? More grammatically correct. For the Koop Award, comprehensive, long-standing, evidence-based health and well-being program with proven results. Innovation, it's recent, significant innovations showing promise for improving health and well-being. 3+ years for the Koop Award, 1+ year for innovation. Evidence requirements, rigorous evaluation for the Koop Award. For the Innovation Award, at least 1 year of provisional data showing impact of the innovation. In terms of eligible applicants, these are programs integrated the organization culture with proven effectiveness, innovation awards showing innovation in design, delivery, or population engagement. The evaluation design expectations for the Koop Award, robust pre-post comparison groups if you have them, statistical rigor. For the Innovation Award, descriptive or pilot data is acceptable. Emphasis on innovative methods and approaches. The scope for the Koop Award, comprehensive population-based innovative elements within or alongside broader health initiatives. The scoring criteria for the Koop Award, organizational efforts, individual efforts, participation rates, and then again, most of it is on methods, outcomes, both health and business. Innovation, we're looking for evidence, novelty, sustainability, participation, health outcomes, and business outcomes. And in terms of vendors, yeah, you can use vendors, but you must disclose them for both the Koop and the Innovation Award. The application length is about the same, but there's a little bit less of a requirement there for the Innovation Award. We've talked about deadlines. And again, the Koop Award, ideal for mature, results-proven programs seeking national validation in the Koop Award name. Innovation Awards, merging early phase innovations, showing promise in improving employee health and outcomes. The question that often comes out is, can you apply for both? And the answer is no. You have to select upfront whether you want to go for the Koop Award or the Innovation Award. And now I'll turn it over to past winner, Jesse Gavin, who's also a board member, and he'll describe what his experience was like going through the application process. Jesse?
Perfect. Thank you so much, Ron. Thank you, everybody, for jumping on. I'm actually going to go tackle this from also a past winner, but also from a past honorable mention. So something to notice is just because you win once does not mean that you're going to win every single time, and we can speak to that as well. So as was mentioned, I'm currently the wellbeing officer at Ballard College of Medicine, but I've been in wellbeing for the past 19, 20 years, worked with different vendor systems and directly with different organizations. I've known about the Koop Award for a long time, and I really think it is, from a award standpoint, the pinnacle of something that you can win from an organizational well-being standpoint. And I've always known that, but I really didn't feel like I was in a space to where the company that I was working for met some of the criteria that Ron went through, being established for 3 years and having the data, which is huge. I think a lot of people on the call, well-being can be housed in different departments, whether it's facilities, legal, you name it, I've seen it. And a lot of times people don't want to share the data, even with people with internally with different departments. And so it makes it a little bit difficult. But with Baylor College of Medicine, I've been with them. This is my 11th year, so I've been there since 2014. I was I was part of the process to start this initiative at Baylor College of Medicine, and so we did have a vendor that we utilized from a wellness portal standpoint. We started biometric screenings, and we hired. I was the first full-time well-being person that we hired. So when the time came, I was chomping at the bit to write this application, to start this application process. I reached out. I asked a lot of questions. As Ron mentioned, I actually went back and looked at a lot of the past applications as far as the framework, how to lay out the application, which I think was very helpful. Just looking at how the past winners structured their applications, especially the data piece. At the time, as I mentioned, I'm a candidate to get my doctorate, but at the time, I really didn't have a lot of experience with data and how to discuss the results of data that you're seeing. And so asked a lot of questions around that. As Ron mentioned, we worked with, working with a vendor, I think is okay. From my standpoint, what I would emphasize is that you don't want to talk about the vendor so much because it's not about what the vendor did, right? You work with vendors, but I'm a strong believer that any platform, portal, anything that you use, it's really a tool. But how did you as an organization use that tool to lead to behavior change? We talked about our communication strategy. We work with our communications team very closely. And we have about 25 to 30 ways that we communicate that tool to the population. So really focus on what you did to help carry that tool across the finish line to show change. You want to make sure that you tell your story. I was big on that. Figuring out what our story was from a Baylor College of Medicine standpoint, how that story changed through the years, how we morphed, how we help people create change. And also from a data perspective, use both, right? So quantitative data, which is very important, ROI, whatever you have access to, but qualitative data is just as important. You're changing people's lives for the better. And anytime that I get an email that says, "Oh, you helped me with this," or we send out satisfaction surveys, gather all that together, and it takes time to gather all that together. But we had a great team. Our well-being program is under human resources, and so we had access to our benefits team, and we worked very closely with our communications team writing the application. Our Baylor medicine team helped us out a lot. And whenever I got the email that said that we were chosen as a winner for the first, I had no expectations. I thought we were going to get honorable mention, and I was happy with that, or thought we wouldn't get anything at all. One of the benefits, I think, as Ron mentioned, is that you have 10 to 15 industry experts that are reviewing these applications, and as a part of whether you're honorable mention, and correct me if I'm wrong, but even if you get honorable mention, you might get this. But if you're a winner, maybe everybody, you get feedback on your application and your program, and you can use that feedback to move forward. And it's just really impactful whenever you see all these comments about what you're doing right. It's gives you that validation of that you're moving the right direction. But not everybody's perfect. Everybody has things that they can continue to improve and enhance and work on, and that's was helpful as well. But honestly, I shed a tear because that meant so much to me, that I was in a place that I was really felt that I could make impactful change, and winning that award. This was back in 2019 when we won. It really just showed that we were on the right path to do that. And so, I'll say again, the health project, everybody is always there to help out. Great team, and I'm very happy to be a part of that team now. And so if you have any questions for me after this call, I know we're going to take a lot of questions. But I'm very happy that I have the ability to help pay it forward, because I had so much help whenever we were filling out this application. And I just truly feel that no matter the outcome, it's it's a great process. Just from the filling out the application, and you realize things that you might not even realize otherwise as you're filling it out. And so, you know, I was just so happy that we won. I was happy that we got honorable mention, but that just tells me that there's more that we need to do. You can't submit the same application twice. You have to continue to progress. You know, these skills that I've used now that I'm you know, getting my doctorate degree, I'm applying them to Baylor College of Medicine, and we will apply again in some time. So yeah.
And Jesse, just one question for me. You mentioned bringing in other departments. Were they all sitting around the table saying, you know, how do we craft this, and then how do we use it as a planning and strategic planning and tactical tool that we can move forward, engaging all the different departments of the organization?
Yeah, great question. I'll say that we didn't all sit in a room together to do it. As we're under human resources, so we work very closely with our benefits team. We had a lot of meetings with our vendor partners because we actually did our vendor partner at the time did our ROI analysis. So we were really trying to pull in all the data. How do we get all of these data points to help tell our story about what we've accomplished? But after we received the feedback, we did, you know, go to the individual areas that we looked at and we got feedback that we could improve on a little bit and said, you know, this is where we can move forward with that. And so a little bit of both, more on a holistic standpoint on the back end after the feedback, but we did meet with a lot of people individually. Some couple of departments were together at the same time, but yeah, not everybody in the same room beforehand.
Yeah, we've heard from other past winners that this was, you know, one of the first opportunities to get everybody on the same page in terms of what are we trying to do and how are we going to do it, and really brought cohesiveness to the organization. We're gonna
Yeah.
we're gonna turn the mic on in a minute for any question from the audience, but here's some questions that we often hear about. Number one, is there an application fee? No, this is absolutely free, and as Jesse and others and I said, you get a lot of feedback from a lot of experts. So it's basically a way to get feedback from experts out there without having to pay for that kind of consulting. Would the information reported and submitted in the application be kept private and confidential, not shared with any members of the public? Well, the winner applications are posted on our website, along with positive feedback provided by the reviewers, not the needs improvement feedback, but we do ask that the winners basically say, yeah, we want others to learn from our experience, and therefore our application will be posted publicly. When will winners be notified, and how will the winners be announced? We typically assemble as a board in August, July, August, and we make our public announcements around September before the actual award ceremony. Is there a common source available, recommendations provided to applicants regarding independent third-party evaluation assistance, preparing documentation, and so forth? No, basically it's either internal staff and experts you have within the organization, or again, if you do bring in vendors and outside organizations, consultants and universities, just revealing that they were in as part of that application process, so that we know who was involved. And as Jesse mentioned, we're not really evaluating the program itself. So this is not a marketing application for the vendor or partner in this. It's really an application for the organization itself, and what it has accomplished with the vendors and third-party evaluators supporting that achievement and those data. And with that, I'm going to actually stop sharing, and David, you can lead us through the process of questions, or actually, I guess people can raise their hand.
I think in the webinar function like this, it doesn't work the same way, but we've got some submitted items here, so we'll get started. I'll pitch them out to you for you to answer, or Jesse, if you've got answers based on your experience as well. So there's some concrete ones in terms of logistics of submitting an application, which is important, and we get a lot of questions like this. So the first is with the word count in the application for the Koop Award. Do the graphics and tables and charts and other supporting materials count towards that word count?
No, they don't. So those can be independent, and even we specify font size, 12 point, and so forth. We understand that sometimes tables and charts and graphs, you can't do that, and they look quite awkward. But it has to be legible. We've received charts and graphs that are so tiny, even when you magnify the screen a million times, you still couldn't see it. So no, it can be a chart and graph in whatever format, but it's got to be readable by the reviewer.
Okay, thanks. And in terms of font size that you mentioned, the 12-point font for the application, does that apply to titles and headers and all of that within the application, or just for the body content?
The body, so titles and headers, if you want to make them larger, that's fine.
Okay. So the supplemental section also, that's not the word count piece as well that you mentioned. So on the cover page, the vendor section, are you just looking for the names of the vendors who help prepare the application, or vendors who also support the health and well-being efforts? Is it just those that contributed to the application?
Those that contributed to the application, more interesting than those that actually support the organization and its efforts, but those who helped prepare the data, even reviewing, editing, and those are the people we're interested in.
Okay. And I assume that, with the supplemental materials not counting towards the word limits in there, that also goes for things like the supporting letter from the CEO and that sort of thing as well.
Yeah, that's something that we look with great interest. If there are support levels from senior level managers, leaders of the organization, that's something that shows that uh, this is an organizational effort, an initiative, as opposed to just one department doing this.
Thanks. So, for the sort of check and review to make sure the application is complete, and any feedback that occurs at that stage, how long can people expect that to take? So in case they need to make modifications or so on.
Yeah, I mean, we'll probably get that done in 3 to 5 days. And again, we're just scanning the instrument, the application rather, to see if there are things that are wildly off. For example, we received an application recently where they had charts and graphs, but they didn't label them. So we didn't know what the bars or what the lines were, and they just left it out. Another application we received, they didn't include the ends. So it's just percentages or, just an ROI number out of the blue, and we needed to know how that was calculated.
In terms of the submission of the application itself, file format, does it matter? Word document, PDF conversion, what's the preference?
PDF is preferred, yeah. So that way, you can't go in there and mess anything around. So yeah, take your file and convert it to PDF and send it along to the website, the email address, the health project, and then also copy me, and I think my email address is up there as well. It was also at the start of this presentation to make sure that it's received, and we'll send back an acknowledgement saying we have received your application.
Right, so they know they're done at that point and can relax. The submission of the application, does that happen? Does it get emailed somewhere? Is it uploaded at a link? How does that work?
Email works fine. And I know this is different than some other applications out there. So yeah, once you have your application PDF and so forth, just send it along as a PDF, and that way it doesn't take a lot of space.
Great, thanks. As we're tackling these questions, if others have questions or things that have come up that they've thought or wondered about along the way, don't forget to drop them into the Q&A box here so that we see them and can make sure that we respond to those. I have another question in here that asks about a higher education institution. So if you're at a university or at a college, should you include efforts related to the student body because they're part of the system, they're a customer in terms of services that may be provided, or is it just meant to focus on employees, so faculty and staff?
Yeah, the focus really is on employees, faculty, and staff, and not so much on the student population. And we understand that a lot of times it's integrated, so that you're providing programs, you're also making them available to students. But in many cases, they're not. They're quite separate because there are different benefit programs available. There are access to some programs that are available to students, but not to faculty and staff. So I want to keep it clean and just the workers, the employees. Full-time, part-time doesn't matter, but staff and faculty in the university setting.
Thanks.
Yeah, and I think, well, just to add to that, I think, from our standpoint, as Ron just mentioned, our student program is completely separate than our employee program. Like our employee program is called Be Well, our student program is called Life. Incentives have to be different because we don't pay students and taxable item implications that come from that from the IRS. So, we didn't even start the student program at the same time as the employee program. So even if we did do it again, from that knowledge, we'd probably still keep it to employees. But I would probably say if we did it for another application, it would be two separate applications because it's completely distinct programs from each other.
So a sort of related question to the student, faculty, staff question. What about health promotion programs that are more community-based? Is that appropriate for the Koop Award or the Innovation Award, or is the focus employer-based solutions?
Right now it's employer-based, but we are thinking about community-based programs. So that's on the drawing board. We've been contacted by some organizations say, we've got great community programs and we'd like to submit those. The distinction there being employer-sponsored or encouraged or supported programs as opposed to the public health department, let's say, doing it. So again, what we're trying to do is underscore the importance of the business community and the employer community in improving the health and well-being of the nation. And not just relying, although it's really, really important, relying on government resources. So we are thinking about community awards down the pike, but right now we have the Koop Award, which has been around for decades. Innovation just introduced, and we're thinking about new award programs in the future.
So a question: we have a number of people on the webinar today who are with vendor companies or with consulting and sort of third parties who work with employers. How can people in roles with vendors or who are supporting employers best contribute to a successful application? What's an appropriate role for that? Are there lines they shouldn't cross in participating and helping to do an application? Like, what's your view of an appropriate and effective role in vendor supporting applicants?
Yeah, I mean, the questions are fairly straightforward and kind of objective narrative is what's being asked for. We've received applications that are basically marketing brochures for vendors that tell you how wonderful they are, but they don't really give you objective information about their efforts and their success. And that's fairly obvious when you submit an application and it's written primarily by the vendor, and you can tell that they're selling the program as opposed to providing objective data.
Yeah, and that certainly will not help the scoring results of an application and would not be viewed positively by the judges as they're looking at it, who really are looking for solid evidence-based programs that have been well evaluated and reviewed. Jesse, did you?
I think from from a consulting perspective, you might be able to share the sources of data. Like maybe we should get this from this group, or we have this data that would probably good. So I think that role might be really great for defining who needs to be at the table having these conversations, and maybe a broker would be the one to kind of act as a communication bridge to help get those people at the table to write that narrative. So I think that maybe that would be helpful from their perspective.
Yeah, I think as as a vendor, or if you're supporting efforts in a solid program, you obviously want to see those successful programs get highlighted and acknowledged as best practice. How can somebody in a vendor support role like that encourage their clients or the organizations they work with to apply, and the value of applying for the Koop Award?
Well, we've seen vendors who have talked publicly about working with a certain organization that has won the Koop Award. So oftentimes they can say, well, we have provided services to the following, three winners of the Koop Award, and that is part of their marketing claims. The Koop logo and the award logo and all that can be used by the organization winning the award. And if they want to publicize winning the award with their vendors alongside them, that's fine. But yeah, I think it's a very high bar, of course, to win the Koop Award because of the data requirements. And vendors who win it have touted that award and touted that they've been partners with these winners in their presentations.
We have a question in here asking, are there award-winning companies, those who've won the Koop Award before, who are willing to be mentors to other companies who are new to the process or earlier in the stages?
Well, that's all right. Jesse's raising his hand right there. And we have had webinars, and you'll find it on our website, from past winners who've talked about their process and their data. We don't want to impose on anybody's time, but they have volunteered, very graciously volunteered, to tell their stories. Certainly you can reach out to us, and we can then reach out to other organizations. So if you're a university or a mining company or national organization that may want some support and guidance, reach out to us. We can then reach out to the organization you're interested in, and if they're willing, then we can connect you.
So here's a question that relates to how organizations are evaluated relative to the context that they're in. So are multi-site programs evaluated or held to different standards compared to single-site programs, or those with more simple programs in terms of consistency, scalability, size of the organization? Like, are there differences in the way organizations are evaluated?
Yeah, we recognize that it's much harder to get a salesperson out in Iowa, as an employee out there versus somebody at headquarters who has access to a gym, let's say. That should be included in the application. So if there are subpopulations that are scattered in very small locations or small groups, what is being done to engage them and support them? Whether it's access to local facilities and resources, or making them part of groups, resource groups, or whatever that they can work together on. But yeah, we understand that some organizations are heavily concentrated in certain areas. You can do a whole lot more, and some organizations are all over the map. But that may be an example of why an innovation award is appropriate, because if you've got farm workers in the field, for example, or people who are logging and out in the forest, how do you reach them? Would be an innovative way of connecting those populations to the central mission of your program.
Yes,
and if I could add to that real quick as well, and I think this maybe alludes to a little bit of the question also, because there's certain awards where you're competing against each other. And it's a ranking system, it's an algorithm, and some people have 200 employees that are all based in one building versus, Baylor College of Medicine and doctors that are all over the country, all over the world. And you're like, well, if I had that company, I would do this, this, and this at that location. So I think one of the great things about the Koop Award is that it's really you telling your story and the outcomes that you are doing. You're not really, of course, in the minds of the reviewers, they're taking the context of everything they've seen in their career, but it's not you versus you. You're a winner and you're an honorable mention. Some years there's 3 winners, some years there's no winners, and so you just have to do great about telling your story and how your organization is set up, and not like this. I'm going against this small location and they might win and I might not. So I think that's helpful as well.
Yeah, it's a good point about it being based. You're being evaluated based on a set of criteria, not against one another. So that's important. Back to the issue of size of organization, or where they are geographically distributed and so on. What about international programs or global components? In a multinational kind of setting, can that be considered if a majority of the implementation is still U.S. based?
Yes, yeah. So if you're an international organization, yes, you can apply for the Koop Award. You just have to show documentary evidence of health improvement in that population and business outcomes relevant to that business. So we've had applications from around the world, not many, but something that's important to the local business, to the local organization that they were able to quantify.
Ron, could you talk a little bit about how award winners are highlighted and recognized and get visibility from the process? You mentioned that the award-winning applications get posted to the website. We have a number of videos that highlight case examples and so on, but are there other ways that in winning the award that you get highlighted and sort of showcased?
We do announce them in press releases, and those are disseminated to various media organizations. We encourage board members, advisors, and anybody, and we've got about 250 people on our mailing list who really are into what the award is about. We encourage them to post it on their social media platforms. We've been quite successful in getting the word out about the Koop Award being kind of the Academy Awards, the Oscar for health and well-being awards, because of our emphasis on data and outcomes. But we can always do better. We've had Surgeon Generals on our website, Surgeon General Murthy, Carmona, and we will have others, we hope, who publicize the award as well. But yeah, it's always hard to get the attention of audiences. We certainly talk about it at the Hero Forum and on the website, and the donors and sponsors of the award. They certainly know who the winners are and why. But we can always do better. So for anyone who has ideas of how to publicize it, even beyond what we're doing, we're all open to that.
Yeah, I want to come back for a second to the Innovation Award and it's sort of being more accessible to organizations that might be smaller or don't have as rigorous of a program in place yet, or as long-standing of a program in place. So that you raised an issue that I think is an important one, is that the Koop Award application is, I mean, it's a hefty application. It's a rigorous criteria, and it's held to a very high standard, which is why it's like the Academy Awards. It's the gold standard programs that are doing this work. And so the perception can be sometimes that it takes a lot of resources. You have to have a very robust program. It's complicated, and those things are true to a degree. But you can have good programs in many ways. But the Innovation Award, I think, particularly lends itself to smaller organizations who, in many cases, can have an advantage in being able to customize or do something in a very unique way to meet the challenges or needs or specific circumstances that they face that sometimes might be very difficult to accomplish in a more bureaucratic, complex kind of larger business environment. So, I want to encourage those who maybe even in smaller settings that are doing creative, innovative things to reach hard to reach populations or underserved populations, finding unique delivery mechanisms or approaches that haven't been as well established. That it's a great opportunity to highlight and showcase those things without having to say, oh, we've got to have like this hugely complex data analysis around all of these pieces. Obviously, we want to know that what you're doing is based on good science and it's producing results, but it's a different application and a different award from the Koop Award. I also want to go back to the Koop Award and the process, Ron, and ask, from your perspective, what are the biggest pitfalls or mistakes you've seen in Koop Award applications that either were problematic enough that it would take an organization out of the running, or it would derail an otherwise really good application that made critical mistakes in what they did? What are the biggest problems that you've seen in applications over the years?
Before I answer that, there was a question there as to where should I send the application, and I put up the title slide because it has my email address on it. But also the healthproject.com, you'll find the application up there and how to submit it. But that's my email there, rgoetze1@jh.edu. So the question about what the biggest mistakes are, I think it's giving bulleted results without showing documentation. So we improved, we lowered obesity rates by 14%, and we reduced smoking rates by 100%, and we did this and that, and we had an ROI of 3 to 1. And it's just bullets without any data to support those claims. That and having data that is not really well organized. So we've seen many charts and graphs, but there isn't a story to support what's in the chart and graph. What is it showing you? I mean, it's showing this and that, but what does it all mean? So it's very basic. So if you are looking at participation rates, you've got to show the number of people participating in the program and what the denominator is. How many people are eligible for the program, how many people participated. If you're showing health improvement and you want to show reduction in obesity rates, what was the obesity rate before you started the program or at a certain baseline level, and what is it now? Has it improved? Smoking, physical activity, depression, stress, morale, whatever it is you're documenting, you want to show a trend line. You want to show that things are going, but always provide not just percentages, but also the end, so we can do our own calculations. And on the business side, again, we won an award or something, but it's something that's really relevant to the economic interests of that organization. And you probably know what that is. And if you present it in a credible way, then we're going to acknowledge that.
Jesse, I had a question for you as former winner and applicant to the awards. What were the biggest challenges in the application that you faced, and then how did you surmount those?
Yeah, and hopefully the audio, of course, right now is going to long people are here. I think for us, like I mentioned, I didn't have too much experience with data collection and data reporting. And so I really relied on the past applications and how they structured it. And actually on the Koop Award website, there is kind of a PDF outline of how to structure certain things. So I think that was a little bit difficult for me at the time. And also trying to determine what is best for our organization to help tell our story. We're fortunate that I do have access to a lot more data now, more than I've ever had before. But like Ron just mentioned, a data point can be just a data point, but it's whenever you really start to build that story around that data point that it becomes impactful, and the reader can really draw that conclusion that what you did made a difference to your organization. So, those were probably the two that I would say is the most difficult. We really had, because I really stressed the importance in that being the Academy Award, and this is, and even after the fact, we've been fortunate to win multiple awards, but I've told people after the fact that, no, this one's different. That we put a lot of work in this award, and it's not just an algorithm saying, yeah, you check this box, so it's 3 points and it adds up to the score. It's really up there. And so we didn't have too much trouble getting people on board because I stressed the importance of doing it. And of course, Baylor College of Medicine, we will like to win a good old award whenever we can. Whenever we can.
Well, thanks for the reminder of the content that's available on the website, and that can be good resources as people are completing applications. The application materials themselves also provide a lot of guidance within them. So it's for me as a reviewer also in the process. I think if you respond to the sections of the application and you answer all of what it's asking you, and you've looked at the guidance within the application materials of how to structure it, what you need to include, if you answer all of that, you will score well on there with a solid program. So, there's no secret behind it or special formula. Flowery writing isn't going to help you on it. It really is responding to what is being asked for in the application, giving all of that and complete responses. And then looking, if you're not sure how to respond, look in the application, because there's a lot of information about how to do that. And then finally, if it still is unclear, if you have a question, reach out and contact us and ask us, and we'll provide input and feedback to help clarify that, so you make sure that you're completing it in a way that's consistent with what we're looking for.
Yeah, and there's a FAQ section on the website, so any question we receive, we'll respond and post the answer there. So it's not individuals you want to reach out to, it's everybody that will have access to the answers.
And Ron, I know we're getting toward the end of time, and we've gone through all the questions that have been submitted. Do you want to remind people one more time about the deadlines for the two different awards, so they've got it on their calendars and in front of them and are planning if they're intending to apply this year?
Yeah, we are now mid-April. Yesterday was tax day, so we've got, if you want to submit a pre-application to get some quality review, it's due in about a month. Otherwise, the Koop Award is May 30th, the end of the month of May, and the Innovation Award the end of the month of June, and you've got a little bit more time for that. So please, look at the application, look at the award winners, look at the programs, and they can help guide what you're doing and perfect what you're doing so that it becomes a Koop winner or an honorable mention. And with that, thank you, everybody. Thank you, David, for facilitating. Thank you, Jesse, for talking about your experience as a Koop applicant. And really appreciate everybody's time and attention. Take good care. Have a great week.